So this is a cool way to mobilize the sides of the pelvic floor in a unilateral kind of way. My chair's not the best because it's got these stupid arms on it. A chair without arms is better. Just means I've got to stick my leg through the arm. So I want to sit right on the edge of the chair, so my right sit bone is hanging off the chair. This is good. I can hold on to that. This hand on the knee. And then all I'm doing is just letting the right sit bone sink down toward the floor, and then lifting the right sit bone back up toward the ceiling. So I'm sinking down toward the floor and lifting up toward the ceiling. Now, being that you're good with your pelvic floor contractions, I'm going to lift with my exhale and lower back down with the inhale. And as I lift with that exhale, I'm thinking of pulling up the right side of the pelvic floor from the center, from the perineum, I think pulling up toward the outside of the hip, and then releasing with the inhale and just letting all that right side of the pelvic floor drop back down towards the sit bone. And as always, if you've got that bunched up feeling, we're looking more for the lower with the pelvic muscles. So the lift is just a gentle awareness pulling up from the center toward the inside of the right pelvis, and then nice deep inhale, let the abdominal soften, let that breath go all the way down to the sit bone, down to the tailbone. And we can also add in a bit of a swing forward and back. So I'm just lowering, reaching forward through the thigh bone, and then lowering and reaching back through the thigh bone. I usually do quite a few of these, about 10 of each. And then changing over to the left side, notice how that feels. If that's your better side, often it teaches your body, teaches your brain, oh, that's what it's meant to feel like. And then when we come back to the first side, it can often feel a little better, a little freer. But also, just always doing it in a soft, relaxed kind of way. Shocking head posture there, Brett. And then of course I would go to the other side and repeat, lowering and lifting, not quite on the edge there. And even I notice, I don't know if you can see it or not, but there's a lot more movement on this side of my body, a lot more movement down this side of my body. I'm just going to suggest there's a lot more movement in the pelvic floor muscles. And again, now I can go, oh wow, that's what that's meant to feel like. A little bit of my half circle, semicircle, dip, forward, lift, dip, backward, lift. A couple of times again, and then I'll go back to the first side and see whether the first side learned anything off the second side. Good luck.